Welcome everyone to the Statewide Medicaid Managed Care Long-Term Care Program webinar for long-term care potential network providers. This presentation is part of a series designed to teach you about the statewide Medicaid Managed Care Long-Term Care Program. In particular, this presentation will teach you about recipient eligibility verification in the statewide Medicaid Managed Care Long-Term Care Program. To access today's presentation, please follow the link below to the SMMC website. That would be aka.myflorida.com/SMMC and select the News and Events tab under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event and Training Materials to download today's presentation. You may also view details regarding future SMMC events by selecting the calendar of events and trainings. Last, choose the files you would like to save. Another note, you may also view files from past events and ACA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenter. We have Melissa Ferguson with the Agency for Healthcare Administration. Today's presentation does not include a live chat session, but please feel free to email questions relating to today's presentation to slmedicaidmanagedcare@aka.myflorida.com. Answers to these questions will be posted to the SMMC News and Events tab under Frequently Asked Questions. I will now hand you over to Melissa.
Thank you for joining us. Florida Medicaid is implementing a new program for Medicaid enrollees. The statewide Medicaid Managed Care Program has two components: long-term care, or LTC, and managed medical assistance, or MMA. The long-term care program began implementation August 1st, 2013, and continues to roll out through March 2014. Long-term care services for most Medicaid-eligible individuals in nursing facilities and many receiving home and community-based long-term care services will now be provided by one of 6 HMOs or one PSN. Services that are covered by the long-term care program include adult companion care, adult day health care, assisted living, assisted care, attendant care, behavioral management, care coordination and case management, caregiver training, home accessibility adaptation, home-delivered meals, homemaker, non-emergency transportation, hospice, intermittent and skilled nursing, medical equipment and supplies, medication administration and medication management, nursing facility, nutritional assessment and risk reduction, personal care, personal emergency response system, respite care, and therapies for occupational, physical, respiratory, and speech services. Please note that each recipient will not receive all of the services listed. Recipients in the long-term care program will work with a case manager who will help determine the services that each recipient needs based on their respective conditions. The long-term care benefit plan requires full Medicaid eligibility. Recipients must be eligible for one of the long-term care program codes in order to be eligible for long-term care services. Please keep in mind that the recipient can be in multiple benefit plans that must be checked, and in just a little bit we will have some screenshots to walk you through that. Please note that if a person is in a long-term care plan, the provider must ensure that they have authorization from the long-term care plan before rendering services. In terms of who is eligible for long-term care, there are certain categories of populations: mandatory, voluntary, and excluded. Mandatory populations are required to enroll in the long-term care program. For the long-term care program, eligible recipients ages 18 or older in any of the following programs or eligibility categories are required to enroll in a long-term care plan if they have been determined by CARES to meet the nursing facility level of care. Temporary assistance to needy families, commonly called TANF, SSI, which is the aged, blind, and disabled population, institutional care, hospice, aged disabled adult waiver, individuals who age out of children's medical services and meet the following criteria for the aged disabled adult waiver are also mandatory. They received care from CMS prior to turning 21. They're now 21 or older, cognitively intact, medically complex, and technologically dependent. Some additional mandatory populations: assisted living waiver, meds AD or SOBRA for aged and disabled, nursing home diversion waiver, protected Medicaid for the aged and disabled, channeling waiver, dual eligibles. Those are recipients who have Medicare and Medicaid at the same time, low-income families and children, individuals enrolled in the Frail Elderly Program component of United Healthcare HMO, meds or SOBRA for children age 18 to 20, and Medicaid pending for long-term care, home and community-based waiver services. We'll get into a little bit more detail about Medicaid pending because that is a new area for long-term care. Voluntary populations are those Medicaid recipients who may choose to join a long-term care plan if they meet the level of care, but they don't have to. Those include traumatic brain and spinal cord injury waiver recipients, model waiver ages 18 to 20, Project AIDS Care waiver, also called the PAC waiver, developmental disabilities, I-budget waiver, adult cystic fibrosis waiver, SOBRA for the aged and disabled, enrolled in a DD waiver, program of all-inclusive care for the elderly, commonly called PACE, recipients with other creditable coverage, excluding Medicare, and familial dysautonomia waiver. There are other populations who are excluded from the long-term care program. That means they are not eligible to enroll. These populations include SSI recipients enrolled in a developmental disabilities waiver, Medikids, refugee assistance recipients, model waiver under age 18, SOBRA children under age 18, family planning waiver, presumptive newborns, SOBRA for pregnant women, women enrolled in Medicaid only through the breast and cervical cancer program, foster care kits, presumptively eligible pregnant women, recipients in an emergency shelter or a Department of Juvenile Justice residential facility, institutional care by transfer of assets, medically needy, which you may also know as share of cost, and emergency assistance for aliens. Also excluded from managed care are qualified individuals, qualified Medicare beneficiaries, commonly called QIMBs, special low-income beneficiaries, you may have heard the term SLIMB, and the working disabled. In addition, recipients residing in residential commitment facilities operated through DJJ, which is the Department of Juvenile Justice, or mental health facilities are excluded, as are recipients residing in developmental disability centers, including Sunland and Takakali. Children receiving services in a prescribed pediatric extended care center or PPAC are excluded, as are children with chronic conditions who are enrolled in children's medical services. Recipients in the health insurance premium payment program are likewise excluded. So let's talk a little bit about ways that you can access recipient information. Please remember, it is the provider's responsibility to verify a recipient's Medicaid eligibility prior to providing any Medicaid reimbursable services. Also keep in mind that possession of a Medicaid ID card in and of itself does not mean a recipient is eligible for Medicaid services. A provider should verify a recipient's eligibility each time the recipient receives services. Medicaid will not reimburse a provider for any service rendered on a day on which the recipient of the service was ineligible. There are many ways that you can access recipient information and confirm eligibility. You can call the self-service automated voice response system, and the number is on your screen. It's the first bullet on slide 25. You can get online real-time verification through the secure web portal. You can submit batch transactions supporting the standard X12, 270, 271 verification through the web portal, or you can use a point-of-sale device through an approved Florida Medicaid MEV vendor. Through the automated voice response system mentioned in the first bullet, you can request a report that has all of the information for the particular recipient, and you can have it faxed to your office. The point-of-sale devices are similar to the small box-like devices used in stores for the credit card or debit card purchases. When using a point-of-sale device, the Medicaid card can be swiped through the terminal's card reader, or the recipient can access information by entering information by hand. The information that is available, regardless of which method you use, you can check dates of service within the past 12 months, and you will get back the Medicaid program code or aid category, hospital or other service limitations, managed care membership, third-party insurance coverage, and the policy number. If someone is also with Medicare, you will get their Medicare number and information relating to Medicare Part A and B coverage. And if the recipient resides in a nursing home, you will get that status as well. And again, all of this information will be provided back to you regardless of which method you use to check eligibility. The provider should record the recipient's Medicaid ID number and other relevant information obtained from the eligibility verification for billing and compliance purposes. For example, you can obtain a call reference number through the automated voice response system, or if you use the web portal, you can simply print out the page and put it in the recipient's file. Just in case there is ever a discrepancy at a later time, you will then be able to document what you found when you initially checked the recipient's eligibility. We'll talk now a little bit about two new eligibility aid categories for the long-term care program. As you start checking eligibility, you will notice Med-P, which is for Medicaid pending, and 6T, which is for 60 days loss of eligibility. So what is the Med-P category? The Med-P aid category applies to individuals who apply for the long-term care program to receive home and community-based services and to meet medical eligibility requirements. While they are still undergoing financial eligibility determination by the Department of Children and Families, they may choose to go ahead and start receiving long-term care services. This option is not available for individuals in nursing facilities. The 6T aid category was created because long-term care plans are required to cover recipients who have lost Medicaid eligibility for 60 days from the date of ineligibility. The 6T aid category allows the recipient to continue enrollment in the managed care plan for 60 days after the loss of eligibility. The long-term care plan is responsible for reimbursing subcontracted providers for the provision of long-term care services during the Medicaid pending period, whether or not the enrollee is ultimately determined financially eligible for Medicaid by the Department of Children and Families. The long-term care plans are required by contract to assist their med-pending enrollees with completing the DCF financial eligibility process. So what does this mean to you as a provider when a recipient has Med-P or 6T? If the recipient is enrolled in a long-term care HMO and they are in that med-pending or in the 60-day loss period, the HMO is responsible for paying the providers in either situation. If the recipient is enrolled in a provider service network, the provider will submit the claims to the PSN. If the recipient is in Med-P or 6T, the PSN will hold the claims and submit them to the Medicaid fiscal agent for processing and payment once the recipient becomes eligible, and that eligibility is added retroactively by the Department of Children and Families to cover the time period when the service was rendered. If a recipient does not become eligible, the claim will not pay. However, the vast majority of recipients in these categories do become Medicaid eligible. Recipient responsibility during the med pending period. If the Department of Children and Families determines that the recipient is not financially eligible for Medicaid, the long-term care plan may terminate services and seek reimbursement from the enrollee. Please note that that does not impact you as a provider, that the long-term care plan in this instance only may seek reimbursement from the individual for documented services, claims, co-payments, and deductibles paid on behalf of the Medicaid pending enrollee for services covered under the long-term care program during the period in which the long-term care plan should have received a capitation payment for the enrollee in Medicaid pending status. The long-term care plan sends the affected enrollee an itemized bill for services, and the itemized bill and related documentation shall be included in the enrollee's case note. Again, please note that this does not impact payments made to you as the provider. So how will you be able to tell if a recipient has MedP or 6T on file? Providers should always verify Medicaid recipient eligibility. When a recipient has an aid category of MedP or 6T and is also enrolled in a long-term care plan, the recipient is deemed to have full Medicaid. When you're verifying eligibility, a returned response will include the MedP or 6T information and the long-term care plan information, including the name and phone number of the long-term care plan. For example, this is a screenshot of what you would see if you were checking eligibility on the Medicaid web portal. You'll note about halfway down the slide to the left, there's a red arrow pointing to the benefit plan of MedP. If you look at the last row, where the yellow arrow is pointing up, you will see that this particular recipient is enrolled in a long-term care plan. So you'll see that combination of MedP or 6T and the enrollment in the managed care span, and that will tell you that the person is enrolled in long-term care and you need to bill the long-term care plan. If a recipient is enrolled in a long-term care plan, a fee-for-service claim for services covered by the long-term care program cannot be submitted directly to Florida Medicaid for payment. The provider needs to contact the recipient's long-term care plan for claim submission and payment. This process is the same as it is currently for recipients enrolled in other managed care plans. So how will claims be impacted with only MedP or 6T? If a professional provider submits a fee-for-service claim directly to the Medicaid fiscal agent for a recipient with MedP or 6T, the provider's claim will be denied with explanation of benefit code 0260. That's EOB code 0260, and the message is service not covered for recipient plan. If an institutional provider submits a fee-for-service claim directly to the Medicaid fiscal agent for a recipient with only MedP or 6T, the provider's claim will be denied with EOB code 4227. The message tied to EOB code 4227 is, this revenue is not covered for this member. If a provider receives either EOB 0260 or 4227, the provider should verify eligibility and contact the long-term care plan noted in the verification response for claim submission and payment. Some important tips when you're verifying Medicaid eligibility for the long-term care program. On slide 39, you see a screenshot, and what we'd like to point out here is the last row with the managed care enrollment span. You can see whether the person is in an HMO or a PSN by looking at the plan name. You'll notice on this particular screen, at the end of the plan name in parentheses, you see LTCC, which stands for long-term care capitated, which indicates an HMO. On screen 45, you'll notice that the plan name at the end now has in parentheses LTCS. This indicates that the recipient is in a provider service network, and that's important to you as a provider for those instances where someone is in the Med-P or 6T category. And what will happen with your claims? The capitated plans will pay immediately. The provider service network will have to hold the claims until eligibility is ultimately determined. So let's review the steps to verify eligibility. It's important to read and review all the eligibility information. It's important to confirm whether the recipient is enrolled in managed care or is in Medicaid fee-for-service. Check whether the recipient has full Medicaid coverage or limited benefits, and verify that the recipient is Medicaid eligible on the date of service and for the specific Medicaid service. Again, just a reminder, it is critical to read and review all the eligibility information. If you don't, the danger is you won't have all of the information to know where to bill your claims. On screen 48, we'll see a shot of an eligibility check, and the red arrow to the left points to the benefit plan of MS, which is full Medicaid. But if you don't look at the entire screen, as you can see on slide 49, what you're looking at also is the managed care information. That is critical to you as providers, because if anyone is enrolled in a long-term care program and you're providing long-term care services, you must go through the long-term care plan to obtain authorization if required and to submit your claim. So please remember to verify whether the recipient is enrolled in a long-term care plan or fee-for-service prior to delivering services. Eligible long-term care recipients are enrolled in HMOs or a PSN. They're required to use a provider contracted in the provider network for all the long-term care program services. The provider must have a contract with the long-term care plan in order to be able to serve the plan's members. The provider must contact the managed care plan to receive authorization to provide services. Long-term care program covered services provided to recipients enrolled in managed care should be billed to the long-term care plan directly. If they are billed to fee-for-service, they will deny. Just a reminder to please verify recipient is eligible for Medicaid on the date of service and for the specific Medicaid service. In summary, when verifying Medicaid eligibility, you should answer the following questions. Did you accurately check recipient eligibility? Is the recipient currently enrolled in managed care? Does the recipient have long-term care coverage? Is the recipient eligible for the date of service and the specific Medicaid service? Do you have authorization from the long-term care plan prior to rendering services? And did you document the verification of recipient eligibility? Some additional resources to help you find out more information or to keep you up to date on the latest. You can mail any questions to FL Medicaid Managed Care at aka.myflorida.com. Updates about the statewide Medicaid Managed Care program are posted regularly at www.aka.myflorida.com/SMMC. Upcoming events and news can be found on the News and Events tab on the Florida Medicaid SMMC landing page. You can also sign up to get automatic email updates by clicking on Sign Up for Program Updates.
I would like to remind you to send any questions you may have to FL Medicaid Managed Care at aka.myflorida.com. And thank you for participating in today's presentation. Have a great day.